Our last topic in this chapter of diffuse diseases will be liver cirrhosis. We all know that cirrhosis is a late stage of hepatic fibrosis. The normal liver parenchyma is damaged and transformed into fibrotic tissue and structurally abnormal nodules. The liver texture is more and more destroyed. The most common causes of cirrhosis are toxic agents, mostly alcohol, chronic hepatitis B, and chronic hepatitis C. Other, more rare reasons can be autoimmune hepatitis, primary biliary cirrhosis, primary sclerosing cholangitis, and also some special storing disorders, for example, Wilson's disease. Cirrhosis of the liver can be asymptomatic for a long time. Blood tests can show decreased liver function, for example, coagulopathy. But patients can also show up with ascites and edema of the legs in advanced cases. Other signs can be so-called spider nevi on the skin or signs of portocaval anastomosis. Some patients show up because of increasing confusion and disorientation because they have hepatic encephalopathy. Now, what would you think cirrhosis looks like in ultrasound? Let's get some pictures. Let's take a look at this picture over here. What would you think? When you take a look at the capsular contour of the liver, is it smooth? I think it's quite irregular. It's like small little humps everywhere. So that's a feature of liver cirrhosis, that the liver contour is not regular. It's irregular and a little bit humpy like here. And when we take a look at the liver parenchyma over here, the echogenicity is not homogeneous. The tissue is not homogeneous. It's somehow irregular too. And also take a look at this small dark area over here. That's free fluid, and that points to ascites. So that means this patient has already an advanced case of hepatic cirrhosis. Also in the next picture, let's take a look if we can find these features too. Again, we got the irregular capsular contour, the inhomogeneous parenchyma of the liver, and also here this small dark area around the liver, which is ascites. In this picture, we can see easily that the liver is enlarged too. We can compare it to the right kidney over here, and we can easily see that the inferior border of the liver is reaching more caudal than the inferior pole of the kidney over here. So that's a sign of cirrhosis too. The liver can be enlarged. In very advanced cases, it can also be shrunken a little bit smaller. But in this case, we can see an enlarged liver, especially in comparison to the kidney. Liver veins are narrowed. Again, an inhomogeneous texture of the parenchyma, here ascites, and the irregular contour. In this picture, because of the ascites around the left liver lobe, we can very clearly see the little humps of liver surface. No smooth capsule, but an irregular one. This is a video clip of the left liver lobe over here. Again, mind the irregular capsule, the irregular contour, not smooth, the inhomogeneous texture of liver parenchyma. And in this video, I show you another organ. This is not the liver, but this is the spleen. Why do I show this to you now? It's because when there's cirrhosis, sometimes there's portal hypertension present. And when there's portal hypertension, there can be splenomegaly. And this dilated vessel over here, beautifully seen, is the splenic vein. In this video, again, a liver cirrhosis. This is the right liver lobe over here. And there's something special in this picture. Take a closer look over here. There's a structure we haven't seen until now. And this is artificial. It's liver tips to help patients with his ascites. We got a dilated portal vein. And in this vein, we got this structure over here, which is his tips. Again, we see the ascites in homogeneous texture, narrow liver vein, and the capsula is not so clearly seen over here. So let's recapitulate the ultrasound features of liver cirrhosis. We've seen the humpy, irregular liver surface in comparison to normal smooth capsula. We detected that liver parenchyma has an inhomogeneous echogenicity. We saw that liver veins can be narrowed and that the portal vein can be enlarged because of portal hypertension. And we also saw ascites, so we know that cirrhosis of the liver, especially in advanced cases, is associated with ascites. Now, this was a lot of information. In this chapter, we saw 3 different diffuse liver diseases: liver congestion, hepatic steatosis, and liver cirrhosis. Let's take a break, and when we are back, we proceed to the next chapter of focal liver lesions.